Welcome. Thank you for joining us for Thursday of John Howard Week. Today, we're very excited to have Shawn Martin here joining us to talk a little bit about some harm reduction efforts on the island. So I'm sure he'll speak a little bit more about who he is, but he's the harm reduction coordinator, I believe is the full title, Shawn. And so happy to introduce him here today to present a little bit to us not only about the overdose prevention site, but also on a few other efforts and services provided around the island. And so I'll let you take it away, Shawn.
Hello, thank you, Bren. Good to be with you today here on Lunch and Learn. I know it's not always easy to jump out of that 11:30 appointment to Lunch and Learn, so I appreciate everyone making that happening. Yeah, super. So my name is Shawn Martin. I'm the harm reduction coordinator with the Chief Public Health Office, the PEI Department of Health and Wellness. I'm responsible for developing and overseeing new harm reduction programs and services. And I'll be looking to kind of give an overview of what those programs and services are. I'm going to do my best to stick to 30 minutes or less on the presentation component so that we can leave some time for questions, feedback, and discussion. So with that, I will jump right into it. I'll try that screen share. Let's see. Let's try that. Okay, it says I'm sharing my screen.
Perfect. Looks good. Yes.
Okay, that's awesome. And yeah, this is always an adventure when jumping from Zoom to Teams to other
Google Meet to whatever else you can find. Yeah.
So what I'm doing here now is I'm just kind of expanding the chat here with the other participants, just so I can see who I'm chatting with. Yeah. Okay, I think we're ready. Yes. All right. So let's go into presentation mode. All right, so everyone can see the presentation in full screen, okay? See some heads nodding, that's good, excellent. Okay, so the title says it all, harm reduction services and supports in PEI. Quick outline of what we'll talk about. So what is harm reduction and why is harm reduction important? Quick overview of current harm reduction services and supports. We'll then look at, kind of go through the harm reduction services and supports in those that are in development right now. That'll be implemented soon and in the coming months. So the overdose prevention site would be one. The drug checking services would be another. Phone-based services, Norse and Brave, we'll talk about that. Community drop boxes for safe disposal. Interactive dispensing machines for access to harm reduction and other supplies. So briefly, what is harm reduction? It's a much talked about term, and that's a good thing. And then the other side of that coin is sometimes it can almost like become a buzzword, and then we wonder, well, what does this mean? So this is one definition. I don't think there's a Webster's dictionary definition, but this is one definition. Here is harm reduction is any intervention that helps a person or a community reduce harms related to substance use without necessarily requiring abstinence from substance use. So in that sense, prevention, treatment, harm reduction, all three work together to help build healthy and safe communities. So we need all three. An example I sometimes like to give is, right now I'm in this kind of policy coordinator role, but my background is as a mental health and addictions counselor, where I worked in the treatment side of things. And so for a period of time, my job was to support people with reducing or stopping substance use. And that was a really, really, really good job. We could help a lot of people in that role. And then we also met a significant number of people who either weren't ready to make a change, and change readiness is so important for success around recovery. Folks who practically weren't able to make a change, unmet housing needs, unmet complex mental health challenges. You also meet people who wouldn't meet criteria for a substance use disorder, but may use substances infrequently. And then you'd meet people who would be in recovery, but unfortunately, we know that most people in recovery at some point in their lives will experience a relapse. It's an unfortunate reality. Not everyone, but it is an unfortunate reality. So for all those reasons, there's a role for harm reduction in amongst prevention and treatment. Now, where are we at in Canada? I think, especially probably with this audience, we know that we're in a pretty tough spot when it comes to the toxic drug and overdose crisis. The illicit supply of substances in Canada has become very toxic. Since 2016, over 32,000 people across Canada have died due to drug-related overdoses. And in a lot of cases, these are now called poisonings instead of overdoses, because really that comes down to fentanyl. It's not so much that a person used too much, but it's that they used something that they didn't intend to use, and it was much more potent. So what has driven the vast majority of, I'll call them overdose deaths in Canada, has been fentanyl. Fentanyl is a highly, highly potent synthetic opioid. It's a type of opioid. And it's really taken over the illicit drug supply in many provinces, BC right on through to Ontario. Unfortunately, we're seeing more fentanyl appear in PEI's illicit drug supply, which is very concerning. Just earlier this month, PEI RCMP seized 1.6 kilograms of fentanyl. That may not sound like much, but because it's so potent, that's over 1 million doses. So I know when I read that, I felt a hit in my stomach, because to my knowledge, we've never seen that in PEI. So we really are in new territory. Unfortunately, we're seeing that reflected in the recorded opioid-related overdoses and deaths. Now, I emphasize recorded because we know that overdoses do occur elsewhere in the community that don't get recorded. If a person doesn't present to an emergency department, if a person is administered naloxone by a friend or a roommate and don't seek medical attention, a lot of these aren't being recorded. But in any case, what we do see from recorded overdoses is that year over year, 2019, 2021, 22, they are increasing to a record recorded high in 2022 of, it says 30 here. We're going to update our website in the coming days here, and unfortunately that has gone up to 33 for the year 2022. So, I think I'll just summarize and in kind of saying two things. One, historically, we have been in a different situation in Atlantic Canada compared to Ontario through BC and Yukon, in that fentanyl has typically not been in our illicit drug supply, but that's starting to flip, which is very concerning, and why we're working as we are on harm reduction services and supports. This is a quick chart on, it's kind of grim, I'm not going to lie, what happens when fentanyl enters the illicit drug supply. And this is Ontario. And, the blue line that shoots up, all lines, in fact, record the number of deaths due to drug-related overdoses. These are generally opioids. And the blue line that shoots up right around 2017, and in particular 2018-19, are deaths due to fentanyl. And so we see that it really is driving the vast majority of overdose deaths, in this case in the province of Ontario. The reason why I share this chart is because Ontario was like us until 2017, 2018, where, the illicit supply was not, especially for like down opioids and depressants, had not yet been taken over by fentanyl. This is what that shift looks like. So it's something we're monitoring as carefully as we can, and something we're trying to get in front of when we develop and implement harm reduction services. Okay, current supports and services. I'll not linger too long on this, just for the purpose of time, but I'll just note that, there are existing services in addition to those we're developing. You have the needle exchange program through Health PEI Public Health Nursing. at least 6 sites right across PEI. There are free naloxone kits available at needle exchange program sites and at other locations. And there's information on the government PEI website about the list of locations. PEI has largely implemented its action plan to prevent and mitigate opioid overdoses and deaths. That was developed in 2016-17, if I'm not mistaken. And it was really to respond to the initial crisis, which is now, for all the reasons we've talked about in terms of fentanyl and increasing toxicity, now changing in PEI. So that was largely implemented through resulting in the services we're talking about here. And now the additional services is building on that. You have opioid replacement therapies, and that's kind of, some people think of that as treatment, some people think of it as harm reduction, but in any case, they're extremely important. So there we're talking about Suboxone, Methadone, Sublocade. Those are available through the provincial opioid replacement therapy program, and then through clinics like the Queen Street Recovery Clinic and certain family physicians and that sort of thing. I'll put in a quick plug for the PEI Substance Use and Harm Reduction Drug Program. That's a drug coverage program that the province released in the last 12 months. And it provides coverage for medications like Suboxone, Methadone, and Sublocade for opioid use disorder outside of the provincial program. So if someone's going to a clinic, if someone's going to a primary care provider, coverage is available for those medications. I also want to note that coverage through that same program is available for some really effective addictions medicine treatments for alcohol use disorder. And there I'm referring to acamprosate and naltrexone. So 2 other really good measures. We know that Peers Alliance is very active in the harm reduction space. Native Council PEI active in the harm reduction space. Health PEI, addictions and mental health services, a little more treatment oriented, of course, but it's all part of a continuum. And then you have on the social care and housing, there are some indirectly related harm reduction supports, whether that's the community outreach center or shelter supports across PEI. Just briefly, I'll note that for the newer harm reduction services and supports we're working on, we do have a community harm reduction steering committee, really broad group of stakeholders, service providers, community members to give advice and guidance on how best to implement that. That's been a great group. You have folks in areas of health, social, housing services, public safety, NGOs, municipalities, police services, people with lived and living experience, First Nations and Indigenous organizations, and we also have participation from business organizations there. The idea is let's get everyone at the same table. Let's come to a common understanding of what are the challenges we face, what are the evidence-based solutions, and then how best to go about it. I'll speak a little bit now about the overdose prevention site in particular. Time check, okay. So I'll use the term OPS and when I refer to the overdose prevention site. One of the first things we did, in addition to that community committee I mentioned, was we did some engagement speaking with people who have lived and living experience with substance use. And so we did interviews, we did focus groups, asking people, what would you go to an overdose prevention site? What would it look like? What kind of services should be offered? And this is just a quick summary, but the whole report is available online, and that's the cover of the report. And that's on, what I can do is send to Bryn, perhaps for circulation to this group, a link to our harm reduction website, and this report is on it. Some of the key findings, 87% of the people who we spoke with, and we spoke with 57 people total in the Charlottetown area, where the OPS is to be located. 87% of people said, yes, I would go to an overdose prevention site. And among the pretty small number of people who said no, when providing reasons, we see that they would still really benefit from going to an overdose prevention site, and that could be quite likely overcome through some outreach. People will say like, well, it's something I usually do alone. And then we know that that's a key risk factor. So we think we can increase that further through outreach, even though 87% is very, very good to start with. Another key finding, 100% of participants self-reported substance use in a public space in the last 6 months. And that really speaks to one of the it speaks to two things. One, the need for an overdose prevention site as a designated, supervised indoor environment for people to consume substances instead of in a public space. And it also speaks to, it's consistent with the scientific evidence on overdose prevention sites, which shows time and time again that they reduce public substance use. So that's one of a couple public order benefits they have. The other is reducing the number of inappropriately discarded needles in public spaces. So we'll keep on moving here. Oh, and then finally, I'll just note that folks shared that an OPS could help connect them to services. And that's also consistent with the evidence, the scientific evidence, when OPS and related services are studied, is they actually increase the number of people who access treatment, what I used to do. And the gist of it is it's a more effective way of reaching a hard to reach population, and then kind of, it's a bit of a crude term, but kind of catching someone when their change readiness is higher, and then getting them connected to a service. I've been using this term OPS, I should probably define it. So an overdose prevention site. So it's just a federally approved service approved by Health Canada, provides a safer, supervised environment for people to consume pre-obtained substances and be connected to services. There's a lot of terminology floating around. People may say safe injection site, they may say supervised consumption site. I've heard all kinds of terms. The gist of it is they are functionally the same service. The reason why you'll hear overdose prevention site, not just in PEI, but in New Brunswick, Nova Scotia, straight across Canada, is because two reasons. One, it's just a different, new, streamlined exemption process through Health Canada. Health Canada has given all provinces and territories in Canada an exemption to open what they call urgent public health need sites. They're referred to as overdose prevention sites. And the second reason why I think you see it overdose prevention site as the name of the service is because safe injection site, it's a bit of a misnomer because it indicates that that's the only service provided. When in reality, at overdose prevention sites, and PEI's first OPS will be no exception, there's a range of services to be provided. So the main one is supervised consumption. That's really important. Overdose intervention as needed because staff will be present. Drug checking service are really important, and we'll talk about that in a bit. Distribution and safe disposal of harm reduction supplies, a needle exchange type service. Referral to services, and then external service providers invited to work with staff and clients on site. And that's that connection to services piece. Just a really quick visual kind of overview of the scientific evidence when it comes to overdose prevention sites. Like, it's no secret that there's some controversy around these. There's kind of a fear of the unknown, if I can put it that way. And so because of that, they've been studied to death. And what we see from over 100 peer-reviewed scientific studies on real services, most of which are right here in Canada, is that they have been proven to reduce deaths. They've been proven to reduce public disorder. And that goes back to reducing public substance use, reducing inappropriately discarded needles. They help prevent the spread of HIV and hepatitis C, which, in addition to the health benefits, people can live with better health, that's the main thing, also produces huge cost savings. When people's health improves, they're less likely to require lifelong treatment for HIV or Hep C, costs thousands of dollars per person per year. And they're less likely to be hospitalized in our currently strained health system, which can cost thousands of dollars a day, depending on your health needs. And then finally, we talked about how OPS, they increase the number of people who access services. including addictions and mental health treatment. Go over quickly here the service delivery. So what will service delivery look like at the OPS in Charlottetown? The client population is for adults of all identities, gender, sexuality, etc. We did an overview of the services just a minute ago. Folks may have heard it will be operated by Peers Alliance. That's a PEI-based harm reduction service provider. They have a ton of experience providing harm reduction services. Definitely the right people for the job. Initial hours of operation will be Monday to Friday, 8:30 to 4:30, Saturday and Sunday, 12 to 5. I say initial because really it's about standing up the service, getting the operations up and running, and then by speaking with clients, Peers Alliance, and then the department, we'll look at what hours will best meet clients' needs. I do want to note that for after hours, there are 2 phone-based services that are available 24/7 and offer supervised consumption. Again, 24/7 free, and we'll talk about that in a moment. For staffing, there will be a minimum of 4 staff working at all times. In practice, there will be more. And a minimum of 1 staff will regularly monitor the outside of the site just to, basically implement the policies and procedures on, how loitering is not permitted outside and this sort of thing. Staff are going to receive quite a bit of training from de-escalation to trauma-informed care to advanced overdose response, in addition to your typical training, assist, first aid, CPR, etc. So what does a typical visit look like? Typical visit, if I'm going to walk in the front doors of the overdose prevention site when it's open, I'll walk in, there will be a reception desk. If it's my first time there, I'll do a very short intake. We don't need your health card. We don't need your personal information. Just a quick intake so we understand how best to serve you. If I've been in before, I just register. If I want to include my name, I can. I don't have to. I can use a pseudonym, initials, as long as it's consistent. There is a waiting area in case the consumption area is occupied. And then from there will be the consumption area. So there will be 3 to 4 consumption booths. They're nothing too elaborate. Basically, a chair, a desk, safer use supplies, adequate lighting, safe disposal available. And the 3 modes of consumption we're going to start with are intravenous, inject, intranasal, snort, and oral, swallow. From there, staff will be supervising, monitoring at all times in the consumption area and can respond if a person were to experience an overdose. From there, a person would move to the post-consumption area where they're monitored for a period of time. Now, typically, if a person's going to have an adverse reaction, overdose, or another adverse reaction, usually it happens pretty quickly. But in any case, folks will be monitored for 20 minutes is the rule of thumb. And that's also a really good opportunity for the engagement piece, to have really good engagement conversations with people, to connect people to services. Like I think back to doing clinical work, and it'd be like, sitting in the post-consumption area, Shawn, remember the last time you were in, we were talking about how you're kind of feeling sick and tired. You talked about how you might like to give treatment or opioid replacement therapy another go. Is that something you're still up for? Because I could put a referral in for you today. So that's kind of what the engagement can look like. This is a floor plan here. Just gives you a sense of what the layout will look like. It's a concept drawing, so there may be some small variations, but it just shows reception down at the bottom in the middle, an office to the right, the consumption area around the corner. We'll have some privacy dividers between the consumption area and the post-consumption area, top middle. Then you have a second meeting room, a waiting room, a client washroom, a staff room, and a staff washroom. And this is based on the building that was available, but also based on visiting overdose prevention sites in New Brunswick and Nova Scotia, and speaking with operators right across Canada, looking at their layout, their floor plans, and all the lessons learned there. Location, I'm gonna have to be a little more efficient on time here, but I'll just note that the number one criteria for choosing an OPS location, it's proximity to clients and to the services they access. What we learned in speaking with folks right across Canada is that if it's more than a 20-minute walk on foot from clients and their services, then people won't make it through the doors. And if they don't make it through the doors, they're more likely to use alone, risk of overdose death. They're more likely to use in a public space, public order issues. So the 33 Belmont Street location was chosen because it is in close proximity to shelter services, to outreach services, to clinics and pharmacies and food security services, and most importantly, close to the people who we serve. It is a provincially owned property, and that gives stability to the operator and clients. And then having an existing fixed location means less site prep, which is good for timeliness. We did look at knocked on a lot of doors for alternatives. With a 0 point something vacancy rate in PEI last I checked anyway, options are limited. And in some of the more frequently suggested alternatives, either the facility was completely full or the building was like structurally unsafe to provide a health or human service. And then finally, we get asked sometimes about an integrated facility, co-locating services. That is a service model that exists in parts of Canada, parts of Ontario, BC, and it's a good model. And we know that a new built for purpose facility is a longer term project, and there's a real sense of urgency to stand up a service. So that's a good idea, integrated facility, and we need a service ASAP. Both of those things are true. This is the exterior of the property, no big changes, just other than there will be some updates for accessibility, and there will be fencing around the back, around the sides, just for privacy and as a buffer. I'll be quick on community engagement. We developed a community engagement plan. Myself and volunteers from the Community Harm Reduction Steering Committee, we knocked on over 100 doors in the immediate area. We invited people to question and answer sessions, and we shared information on the service. We had question and answer sessions last Wednesday on the 8th. We had 2. We shared information about the service, we answered questions, and we recorded feedback on how to provide a good service and how best to work with the community. And then when the renovations are complete, we will be doing open house tours. So I'm excited for that. Next steps, renovations are next. And that'll really determine the opening date. I would love for it to open late spring. And it's just going to come down to contractors. So we're just going to work as hard as we can on that and get creative. I mentioned the open house tours when renovations are complete. Really excited to see Peers Alliance operating the service, and then the Department of Health and Wellness. We're funding it, of course. We're going to provide oversight, and there will be regular reporting for performance monitoring. How are we doing? And there will be a program evaluation as well. Was the implementation with fidelity to model? Did we implement in the way we wanted to? Are we delivering on the outcomes of the program? Okay. There are some other services I want to go through just to gauge what level of detail I want to get into. Maybe, Bryn, I'll just check in to see what's our hard stop.
Hard stop, I say, is 1, so you can be flexible. Okay. Yes.
I'll do my best to cover these other services. Leave a little time for Q&A and just be respectful of people's time. So drug checking services are part of what we're working on as well. So very well established across Canada. They're important for point of care. So people know what's in their drugs. They know what they're putting in their body. Is there fentanyl in my drugs? I don't want to use fentanyl. And then number 2, it helps with public health surveillance. That's kind of a ominous term there, surveillance. But really what that just means is CPHO will get data on anonymous data on samples, what's in people's drugs. And then what our plan is there is to put the results, the anonymized results, nobody's names, nobody's information, just the drug checking results online, and then update that regularly. So we can see what's the fentanyl positivity rate, what's the benzodiazepine positivity rate, what percentage of samples are matching the expected substance. And then we can track, for example, fentanyl positivity rate over time, so we can make evidence-informed decisions on where are we at in this overdose crisis. There are two main services that are/will be available on drug checking. I'll start with what's currently available. So fentanyl test strips, they look just like your COVID test strips in terms of the package they're in. They are available through Peers Alliance at their Charlottetown office, at their Summerside office, and through their rural peer lead project. And just recently, fentanyl test strips are available through Health PEI's Needle Exchange program. Again, at those 6 sites across PEI. If I'm not mistaken, it's Alberton, O'Leary, Summerside, Charlottetown, Montague, Surrey. And so that's something you can check online. They're just rolling those out, so they're probably sorting out how many, how much supply do we need at a given site, but they are rolling that out, so that's really exciting. And then in terms of there will be drug checking as well at the overdose prevention site, and that's going to be a lot like we're kind of just copy pasting the BC model, where they have what's called an FTIR spectroscopy, I almost said spectrometer, and I'll show you a picture of the machine, and then fentanyl and benzodiazepine test strips. So that'll be based out of the overdose prevention site. This is what it looks like. It's not like Bill Nye or anything, or like Dexter's Laboratory. It's a community-based drug checking service. So the bluish machine, that is the FTIR unit, and then those green packages, plastic, those are the test strips. They're used in combination, basically to offset the strengths and benefits of each. The test strips will tell you yes, no, positive for fentanyl, negative for fentanyl, positive for benzo, negative for benzo. And then the FTIR machine will tell you the spectrum, what's in the drugs. It detected substances 1, 2, 3, 4 in the sample that you provided. With that said, because it's a machine that is designed for a trained layperson to be able to use, you don't need to be a lab tech. It does have some limitations. For example, if there's less than 5% fentanyl concentration, less than 5% benzo concentration, that machine may not pick it up. So that's why you use the test strips. You use them together, one then the other. So the phone-based services, this is really important, both for just anyone, but especially for folks not in the immediate Charlottetown area. So there are 2 phone-based overdose response services. They are available today. One is called the National Overdose Response Service, or NORS, and the other is called the Brave app. Most important for rural areas and after hours, anywhere. Mention that 20-minute rule of thumb, which is why phone-based services are so important. So in both cases, a person can call into the service when they're going to consume drugs. They would consume them, and then they would get supervised consumption over the phone by a trained staff person or peer. If the caller is unresponsive, then having already established a safety plan, that safety plan would be activated. So 24/7, they're both free, confidential, non-judgmental. And what we oftentimes say is, if you have minutes on your phone, call NORS. It's a phone line. And if you have Wi-Fi or data, you can call Brave. It's kind of one of those digital type calls like WhatsApp or that sort of thing. And I'll just note, we have cards, stickers, promotional materials as per this photo that we can give to anyone. Like, they're very cheap to print. It could save a life. So if anyone on this call or anyone you think of is interested in having them and distributing them to anyone you know, please contact me. And when I follow up with Bryn, I'll have my email will be included there. Community drop boxes for safe disposal. So they look like this. We've installed some already. We're in talks with Summerside and Kensington to install more. That's just safe disposal to reduce discarded needles and give people improved access to safe disposal. I'll just note that we have additional units available. we would give them to an organization or community at no cost, and then we would work with that community so they can, contact a waste disposal service provider, and we have a couple who we can connect you to. So again, if interested in that, just you can contact me, you can contact that email, and we can discuss next steps. I'd like to see them all across PEI. We have some installed in Charlottetown, but obviously we want to reach more communities. And then interactive dispensing machines. This one might take a little more time, but it's a really exciting project nonetheless. So this is what these look like, and they provide free access to harm reduction supplies, to HIV self-test kits, to naloxone kits, even to like, hygiene products, or in some cases, nutritional products, just non-perishable foods. There are a growing number of these set up in New Brunswick, and we would like to join that club. So right now we'll see our first one of these units installed outside the overdose prevention site. And then we're working to get additional units, which we would like to see, for example, in other populations like Summerside, and then to work out to rural regions, West Prince, Kings County, etc. So I kind of blew through those last portions. I'm sure there are thoughts, there are questions. So I will leave it at that, and I'll just feel free to ask any questions. Jane, yes, I see your hand up.
So, hi, thank you for your presentation, Shawn. I really appreciate it. I'm a policy analyst with the Native Council, and the first thing I have to say is just a comment, actually, and that is that unfortunately the mobile harm reduction team will no longer be able to offer its services at the end of March or early April. I'm not sure what the date is, due to a lapse in funding. So unfortunately, yeah, it's really disappointing news for all of us at the Native Council, for sure. We have applied for other funding through a different stream, hoping to get a program going later in the year, maybe. But for now, I think we're not going to be able to provide it. The other thing I do have a couple of questions. I guess I'll begin, and I'll just ask one at first in case other people have questions. And that's around the hours for the overdose prevention site. I think I remember reading in the survey report, or that came out a couple of weeks ago, that that people surveyed had wanted extended hours into the evening, and that's not reflected in the schedule. So I'm just wondering what the reason for that is, or maybe I misremember.
Sure, yeah. No, thank you, Jane. And I'm just with the camera, I'm just seeing that we did meet at the SDH Housing Forum a number of months ago. Okay, yeah, so for the first question, thank you for the update with respect to the mobile harm reduction program. Let me know if I'm on track here. Had that been funded through Health Canada's Substance Use and Addictions Program, SUAP?
I think it might have been, but I'm not 100% sure.
Okay, all right. Okay, and to your point, the survey, yes, the most common response, just for full transparency, was 24/7. That was the most common response. And we looked at that carefully. 7 days a week was a must for someone who was accessing an overdose prevention site. Perhaps not everyone, but most people will be quite active in their substance use. And so that means 7 days a week. So that's a must. And then in terms of hours of operation, it really comes down to organizational capacity. You contract with an operator, and you review proposals, and you look at what is the organizational capacity to provide a service. And that's the balance we're striking here. Had to be 7 days a week. And then we went with the hours of operation that the organizational capacity has at this time. And we know that there will quite likely be changes to the hours of operation, and probably changes in terms of expanding hours of operation. But right now, while an OPS itself is it's certainly not an experiment, it's a very, very well-established service. We're one of only 2 provinces in Canada without one. To implement something, there will be learning. And so that's why we're doing the initial hours of operation. Comes down to capacity plus initial service model, and then growing from there.
Perfect. Thank you. That makes sense.
Thanks. Aaron.
Yeah, hey, Shawn, sorry, just getting on the mute button there. Just a question about individuals that smoke their drugs. Will they be allowed to access the center and smoke inside the center? I know there's been some centers in, I believe, BC that have created like a ventilation vent system to get rid of the smoke. So just curious about that.
Yeah, inhalation is an important consideration. To my knowledge, there are 1, 2, maybe 3 facilities in Canada that offer indoor inhalation. There's one in Saskatoon, Saskatchewan. There's one in the Yukon, and there may still be one in Lethbridge, Alberta. Not sure of their current status. I've spoken with the operators in both Saskatoon and in the Yukon. So we have a good understanding of what the service looks like and what the renovation requirements would be. It's basically a designated inhalation room, sealed type, independent inhalation system, a few other specs. And it's a really good service to offer. We decided, to be honest, like most facilities, we decided to go with the 3 modes of consumption initially for a couple of main reasons. One was so we can implement the service in a more timely manner. And 2, there are some legislative and regulatory factors we need to look into at the provincial level. And then there's some municipal bylaws we would need to work with the city on. A lot of it comes down to the Smoke-Free Places Act, which is a really important piece of public health legislation, huge public health win. And it's designed mainly for fentanyl. You know, when that legislation was implemented, nobody had heard of fentanyl outside of maybe folks working in cancer care or end of life care. So that's why we're going with these 3 modes of consumption. But you know, if you know, we see in PEI what BC is currently experiencing, where the majority of overdose deaths, the mode of consumption is inhalation, whether people intend to consume fentanyl or not, then obviously we'll need to respond. But those just you know, to be very transparent, those were the factors that went into our decision there: timely implementation, and then understanding that there would be some legislative, regulatory, and bylaw barriers to work through in order to offer that service.
Thank you, appreciate that.
No, thank you, Aaron. It's a good question.
I'll ask you one, Shawn. Oh, sorry. Go ahead, Jane.
No, that's okay. If you
Okay.
haven't, take a turn. Go ahead.
Perfect. Thanks. So Shawn, I know you mentioned interactive dispensing machines possibly being on the horizon. I know just from experience in Toronto and past, they've done a lot with those in terms of sexual health and protection again, or safe sex in general. Is that something you guys are planning to kind of branch into long term and combine those in with the efforts, or kind of focus on drug harm reduction first, get that all settled and kind of go from there?
Oh, big time. Yeah. And thank you for raising that, Bryn. I should have mentioned it.
No.
Yes. You know, like the, what will be dispensed by the machine will kind of depend on the local organization and the supplies they choose. But, you know, I would think that you would want to have a good combination of supplies. So not just safer use kits, those are important, of course, but safer sex kits as well. HIV self-test kits. And in the case of like Reach Nexus, for example, which is the organization responsible, I believe, for some of the units in Toronto, that's their focus, is STBBIs, including HIV, Hep C, et cetera. So yeah, that's something you can expect from those.
Perfect. Thank you.
Oh, and I think I do see a hand up. Yeah.
Is it just me? I don't want to jump in if someone else has a question. It looks like no. So one of my other questions is just around the after hours, the NORS and the Brave app. Do you know, just off the top of your head, if there's any data around how effective those are? Like, is the response prompt? Does it actually help to contribute to a reduction in overdoses and deaths?
Yep, they have been evaluated, both Norse and Brave. And I think there's been even more evaluation for a BC specific app called the Lifeguard app. And there, if I remember the evaluation report, it's been a little while since I've read it, but what I seem to remember is that they were particularly effective in suburban and rural areas. Yeah, so which is, I mean, like in PEI, we don't have like much of a distinction between high density urban and then suburban. So really suburban and rural would kind of bleed together, and that's really one of the most important target audiences for me for Norse and Brave, especially like for me, I'm from rural PEI. So while it makes sense to put the first OPS in your population center, you know, in the capital region, 50% of the population in the capital region, you need to cover off the rest of the province. So I'm really grateful that Norse and Brave exist, because the focus there, in addition to after hours, is rural suburban.
Perfect, that makes sense too. Thank you. And just one other question, and you may not know the answer to this either, but just back to that graph that you showed about the sudden spike in the presence of fentanyl. Do you know what the reason for that is? Like, why did it suddenly appear to such an extent in 2017?
Oh, that's a tough question. I don't think I have, you know, capital T the answer for that. Just because it would come down to illicit markets, you know. Yeah, it's very complex because, you know, just an anecdote anyway. I read Benjamin Perrin's book Overdose, a very good book if no one's heard of that. As it happens, former Prime Minister Stephen Harper's legal advisor, and he's become a harm reduction advocate. So there's hope for us all. And he wrote this book called Overdose, where he investigated the causes, and he really wrote it as a reflection of his own evolution, you know, the evolution of his views on this issue. He lives in BC, and he talked to people in border enforcement. He talked to people in policing, and one of the anecdotes that they shared that really stuck with me is they would say, like, when the primary opioid elicited was heroin, you had to ship that profitable amount in a brick that the size of my head. And now you can ship a profitable amount of fentanyl in a greeting card, you know, that you're sending in an envelope. It's so potent. So the more the crackdown happens, the more potent the substance gets. We saw that in PEI 100 years ago, where prohibition came around and we switched from, you know, shipping in beer to shipping in moonshine that would make you go blind. So there's a parallel there. So that's just a little anecdote on why enforcement is so challenging when it comes to fentanyl. Is people don't send bricks of heroin in shipping containers. They send hundreds and thousands of greeting cards with small quantities of fentanyl. There is some domestic production, but a lot of importing into Canada illicitly. And in terms of border and even Canada Post, just with the quantity of letters and packages coming through, stopping fentanyl at the border, I am not optimistic about that. I'm not an expert in it, but I think at the end of the day, they're, despite, you know, the best efforts of RCMP and PEI, seized over 1 million doses recently. Some serious efforts went into that. And I just, in my own personal view, I also think there's some practical limitations to enforcement, which is why the public health approach is so important.
Thank you.
I don't know if there are any other questions or comments for Shawn. Okay, well, thank you, Shawn. One little anecdote I can add, again, from Toronto, is that there are lawyers, my mom's a PO in a jail in Toronto, and there are lawyers actually sending fentanyl in little cards and letters to their inmates while they're in jail. So yeah, don't know if that's happened at the jail here yet, but I think control over, literally anything, especially in such small quantities, is definitely a challenge, especially when the lawyers are the ones who are not cooperating. I don't think the rest of the general public is going to get on that too quickly either, unfortunately. So I would say, though, I think this was a really informative presentation for everyone. I think shows a lot of great steps going forward as well. Which is good. So I know I'm personally very excited to do a little tour once the overdose prevention site's up and running, but also great to hear about things like the needle exchange programs, kind of getting the test strips and everything with them. So that's, yes, great access improving across the province. So thank you for coming today.
No, that's great. I really appreciate the invite and everyone's time. I will send a revised PowerPoint here, and there will be contact information if anyone wants to follow up on any of these projects. Any questions? It's all good.
Perfect. Thanks so much. Yeah, it sounds good. I know we'll be hitting you up for sure for some of those stickers and promotional materials for our caseworkers and outreach workers. That'll be great.
Awesome. Yeah, please do.
Great. Thanks so much.